So iron is required in the production of the red cells or the hemoglobin. And as we know, the hemoglobin is the molecule required to carry oxygen in our body. Iron is usually stored in the bone marrow, spleen, and also in the muscle. Okay. However, it is not produced in the bone marrow. Iron is not produced in the body. The only way iron can be obtained is from external source, which is through consumption from our diet, for example, from supplements and also from the animal base and also the plant base. Yeah. The progression of iron deficiency is categorized into 3 stages. So the first stage, what happens is when the iron starts dropping. The reduction of iron in the body can be due to many reasons. For example, loss in bleeding, or loss in diet consumption, or loss in regular blood donation, and so forth. So when there's a reduction of iron in the body, the first reduction would be in the iron stores, which are also called as ferritin. During this period, the hemoglobin is not affected. So therefore, patients may or may not get some very mild anemic symptoms. For example, mild headache and giddiness, a bit of generalized lethargy, okay, but nothing very apparent. Then goes on to progression to the second stage, where now due to the progression of the iron deficiency, which leads to problem with red cell production. Now, because iron is required to produce red blood cells, declining iron stores basically leads to reduction in hemoglobin production. So now patients tend to have more to mild to moderate anemic symptoms. For example, patients will start having a bit of shortness of breath, especially on an exertion. They tend to get a bit of palpitations. Sometimes they can feel a bit of brain fog and so forth. Yeah. And now at this point, if nothing is done to correct the iron loss, then it progresses to the third stage, where patients then develop an absolute iron deficiency anemia, where the iron store is depleted, and that leads to reduction in the production of red blood cells, and that leads to moderate to severe anemia, where the hemoglobin drops to below levels. And this leads to patient having moderate to severe symptoms of anemia. For example, patient feeling tired and lethargic even at rest. They tend to develop constant or persistent headache and giddiness. Patients tend to have shortness of breath even at rest, palpitations, chest discomfort, and then that goes on to have frequent fainting spells, and the brain fog tends to develop more frequent. Yeah, so the symptoms become very apparent and sometimes lead for patients to end up coming to hospital due to unable to function at all. So these are the various stages of development of iron deficiency leading to a absolute iron deficiency anemia.